All right, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen, and right now you see this blue cannula coming in the front of the shoulder. You're laying on your side, I should point out, so your arm is up in the air. The socket part of the shoulder is down here. That's the glenoid. If you were actually standing up, we would be standing behind you, and it would look like this, with the glenoid here and your arm coming off to the right. That's what it would look like if you were standing up. But because you're laying on your side, it looks like this. And so the rotator cuff tear is right here on the left side of the screen. Free this up a little bit so it doesn't pull anything off. And we're going to use our shaver just so we can do a little bit of work from this, what we call the articular side of the tear, kind of inside out, because this is sometimes our best angle to clean up the undersurface of this tear. And then this is the footprint where it's going to be reattached. I'm just trying to focus a little bit better. There we go. So this is where these tears happen most commonly, right behind or just posterior to the biceps tendon, which you see there. You can see how the undersurface is a bit frayed here. And if we don't have an anchor open, we can. Anchor and a burr, yeah. Okay, so that basically shows us exactly where we need to be working here in just a little bit. I should also mention that we have some PRP ready to go at the end of the case. Going to try and reduce the re-tear rate by injecting some PRP. We'll show you that at the end. We're going to look at your biceps tendon. Your biceps tendon actually looks pretty good here. A little bit frayed, but it's not really torn. And so that's encouraging. I don't think we have to do a tenodesis. Sometimes we do if the biceps is torn. And in terms of the rest of the shoulder on the inside, you don't really have much arthritis here. A little bit of fraying on the cartilage surfaces. You can see some on the humeral head there, but not too bad. Okay, so we're going to go off in the video. We'll show you some more in a little bit. Okay, so we've identified the tear. You can see it right here. Just to the right, you can see the biceps tendon if we move that. See the biceps right there? That little rope-like structure. And the tear is just to the left of that. Very common tear pattern here. And now we're going to take a spinal needle and just kind of plan how we're going to fix this. I think if we bring an anchor down right about there, that would be a good spot. There's the articular margin, so we like to place our anchors back just a little bit. We don't want to be way over here lateral, but we do want to be a little bit off the edge in this situation. So right about there is a good spot. Hold the camera there, please. Scalpel. And then we'll take the guide, and then we'll take the anchor. So we're going to make a little nick in the skin. And then there's our guide. We're going to just do the same exercise we just did with the spinal needle. We're going to place this down about here. And then we're going to place an anchor down. We'll show you some more in just a minute. Preston, go ahead and pull that out and put the anchor in and mallet it down. Okay, good. Now pull back. Okay, and so now there's the triple loaded anchor down in the bone. We'll pull on it just to make sure it's seated. Very solid. I can pull the entire shoulder. And now we're going to take a crochet hook and take out some of these sutures, or actually one of these sutures. No, crochet hook. And then Preston will take a grasper. So we're going to look at these sutures and decide which one we want to work with first. Looks like this solid blue one's a good candidate here. So pull tight on the sutures for me. Okay, and so, sorry about that on the camera. And so now we've got that first suture. Here you go. Put that in the front. That first suture is in the cannula here. And now we're going to take our straight crescent suture hook in from the left side of the screen, which is the back. Nope, take that out. Put the grasper in. Here's what the suture hook looks like. It's loaded with a black relay called a super shuttle. You can see it there. Just wanted to show you. I'm going to pull back on it now. Now, Preston, you hold the camera. 2 hands. I'll take that. And so we're going to get these out of the way. And we're going to make sure that we can reduce this tear in a way that doesn't have any tension, which looks like about like that. See, if I go this way, see how it wrinkles up? We don't want to do that. We want to bring this over here. Okay, hold right there. And that looks like pretty good angle right there. There's our hook coming through. We'll go ahead and retrieve that, and we're going to load that blue wire, I'm sorry, the blue suture into the wire. We'll show you some more in a minute. Pause, please. Okay, so we've got the tear repaired. There's our 3 sutures. Notice that you can't see the biceps tendon anymore because it's covered up. That looks good. And now we're going to take, I'm going to see if we can take an 18 gauge spinal needle, because one of the places I'd like to put some of this PRP would be into the bone. And you can see how that goes right down into the greater tuberosity. And I can measure how deep we go by the outside of the needle. We can see how far the needle's into the bone. So you can see that's down. I'm happy with that. Okay, and now we're going to go ahead and inject some of this. I'm turning the pressure down just a little bit, but we'll go ahead and inject some of the PRP here. I've got 8 cc's of PRP. And as we inject a little bit, you have to remember that we've made a hole in the bone for that suture anchor, so some of that's going to come out here. So I don't want to put too much, or we're going to put some in the subacromial space too. I'm going to go ahead and turn off the pump at this point. So the image picture is going to change. And you can see that's actually marrow coming out of the suture anchor hole. And then let me pull back a little bit. You can see the needle going into the bone here. And as we inject, you'll see even more marrow come out. So that's how we know we're filling up the tuberosity. Now the other thing we're going to do here is pull back on that 18 gauge needle and give you a little better picture here. Hold the camera right there for me. Thank you. Okay, now we have the needle in position. So we're going to inject a little bit into the tendon here, and then the rest in the subacromial space. And then we're going to get you back to the recovery room. So good luck to you now. Bye-bye.